We're now going to talk about a parasite, Babesia, that is again associated with basically tick bites. These are intracellular protozoan parasites. Okay, so that tells you a couple things about its structure. And they look very, very similar to Plasmodia. They are, in fact, not Plasmodia. The Plasmodia are the causative agent of malaria and obviously an incredibly important pathogen worldwide. Um, Babesiosis, which is basically the condition that is caused by Babesia, is a zoonosis, and it infects a variety of animals, such as deer, cattle, and rodents. We are actually accidental hosts of this one. We're not supposed to be in this life cycle, and consequently, we feel the effects of that. It is transmitted by the Ixodes tick. And the Ixodes tick is kind of an annoying little bugger, literally, that spreads a wide variety of infections. So when you're in an area where the Ixodes tick is endemic, like say the northeast of the United States, you're not just worried about babesiosis, you're also worried about Lyme disease, right? So you're worried about these other organisms that are also common. So you kind of keep this one on the same differential that you would keep those on. All right, so I said most of this already, except for the two stages. Remember, anytime we're talking about a parasite, we need to know two specific stages of its life cycle, the infectious stage and the diagnostic stage. So for Babesia, the infective stage are piriform bodies. They're able to actually infect erythrocytes. And that's part of why this disease can often kind of mimic malaria. So malaria, which is caused by Plasmodia, can also infect erythrocytes. So we can see kind of a similar clinical syndrome there, and we'll talk about the clinical syndromes in a minute. The diagnostic stage is a ring form that's seen on the blood smear, and I'm showing a couple of them here, these kind of smaller dots here causing a ring form that you can look for diagnostically. It is very, very difficult to identify Babesia on site, and typically it takes a pathologist who has actually seen Babesia many times before somebody would be certain looking at a blood smear that they were looking at Babesia. All right, the clinical syndrome for babesiosis, there's about a 1 to 4 week incubation period that occurs after the bite of an Ixodes tick. Okay, so you go hiking, you get bitten by an Ixodes tick. About a month later, somewhere in that time, you start to feel kind of a general undifferentiated fever, right? Malaise, fever, headache, chills, sweating, fatigue, weakness, things like that. As the infection progresses, you're going to get increased destruction of red blood cells. Remember, because it infects those erythrocytes, and then as it replicates, the erythrocytes rupture. And that's part of what leads to that fatigue that you're feeling, right? Because when our red blood cells rupture, we're not able to carry oxygen where we need to go. It's a bad scene. So the red blood cell rupture can lead to hemolytic anemia, right? Because that's basically what that means. And the patient can eventually progress to renal failure if this isn't treated. You're also going to expect to see some hepatomegaly and splenomegaly as the body tries to filter out all these destroyed red blood cells. That typically is associated with very advanced disease. Parasitemia is obviously present when we're infecting red blood cells. We should expect to see the parasite in the blood, and that might persist for weeks. There are certain populations that are a little bit more susceptible to kind of advanced babesiosis, particularly patients who have had a splenectomy. If a patient gets in some sort of accident or has some sort of rupture, they might remove the spleen. Functional asplenia, a good example of patients with functional asplenia would be patients with sickle cell, patients who are severely immunosuppressed, be it because of advanced age or cancer or having had an organ transplant or being HIV positive. All of these patients who have this reduced immune response are more susceptible to developing significant babesiosis. Okay, how do we diagnose it? Good news and bad news. There is PCR available, but it is not widely used. You can actually diagnose it by seeing that characteristic ring. Problem, it looks almost exactly the same as the rings seen for Plasmodium. But if the patient has not traveled to a malarial endemic area and does have a ring form in their red blood cells, it's more likely, obviously, to be Babesia than malaria. So, like, if your patient has was born and bred in New Jersey, has never left New Jersey, never went anywhere where malaria is endemic, and you see a ring form, I'd go more toward Babesia than I would malaria. So it becomes kind of the presumptive diagnosis at that point. How are we going to treat it? You're going to treat it with a combination of an antiparasitic and azithromycin. If the patient has a very severe case, you might change things out. So you might add clindamycin and a quinine. And you can also do an exchange transfusion just to like physically remove some of the parasite burden from the body, right? Because since the parasite hangs out in the blood, if we exchange the blood out, if we take some infected blood out and put non-infected blood in, we functionally reduce the amount of parasites present for replication.